Well, good evening, everyone. Welcome back. Tonight's topic is augmenting diabetes reversal. We'll get into what that means in just a few moments. But I want to know how your week has gone. Is anyone still seeing things like blood pressure going down? Anyone see blood pressure? Yes, there's several. Very good. Now, that is one of the first signs that someone is reversing. Oftentimes people will start seeing their blood pressure go down before the blood sugar even begins to trend down. So I love to see that. And let's see, how about fiber intake? How many people are making their quota of 50 grams of fiber or more a day? I can't believe what I'm eating. She says, I can't believe what I'm eating. So anyway, I'm grateful you're eating all kinds of stuff. I'm trusting that it's better than what you were eating before.
As Steve says, she doesn't have room for what she ate before. That's why he says eat your fiber foods first, and it will help to squeeze out some of the other things.
Okay, how about weight loss? How many people have lost? Oh yeah, we have a bunch of hands. Very good, guys. That means you're doing something right. Okay, how many people, let's see, we're on week 6, so how many people are down at least 4 pounds from the starting weight? Yes, very good. We have them all over the room,
good.
Okay? Yeah, that is great. You're right on target. I'm very happy if someone is at least that, and is anyone more than 10 pounds down? Okay. Now, 10 pounds would be on the outside. Then I would be cautioning you, don't lose weight. He's almost there. He's got 8 pounds. Very good. Give him a hand. He's working hard on this. That's great. Now, if you're doing 2 pounds a week, how many pounds would that be in a year?
A lot. They said a lot.
That would be 104 pounds in a year. Yes, absolutely right. But we have people that have gone through a program. A number of people have exceeded the 100 pounds, the 104 pounds. And you'd think, that's a whole person. Yes, it is. I think our top loser is in excess of 150 pounds at this point. But this can be life-changing. And, anyway. I don't want to give away my lecture before we get there. But this is exciting stuff. I get so excited when people have results. Yes, ma'am? 8.7 pounds. Give her a hand.
Good.
That's awesome. Yes. And just remember some of the key things. What are the key things to losing weight? Trying to keep it off?
But how do you lose it in the first place?
Exercise.
And less food in
Fiber. And water. And she says, less food in than what comes out. That's for the benefit of those watching online. Okay, we love having her in our program. You hear lots of laughing. That's usually her.
You guys, this is so much fun to do these programs. I get so pumped when I hear people having results. And if you want to really make my day, give me a call in 3 months or 6 months and say, hey, Steve, I just want to give you an update how I'm doing. And, that's one of the ways that we get these amazing stories that we share with you online is, typically people have it reversed in the 8 weeks. Now, I've seen people reverse in 6 weeks. But that's the exception rather than the rule. Most people, it's going to take them a little longer than that. Lifestyle change is not an immediate fix overnight. It may be 3 months. It may be 6 months. For some people, it may be even more than a year. But the harder you work at it, the more you focus in on those therapeutic interventions we're going to talk about in a little bit, the greater your chances of reversal are. So 1 to 2 pounds a week. That's what I want you aiming to lose. And if you go up, don't get discouraged. Just get back on the bandwagon and keep working, pushing back, pushing the limit, pushing down until you get to that new normal. And your body will eventually stabilize. You will not wither away to nothing. I promise. But you will find a new lifestyle weight that, based on the kind of foods that you're eating. Well, this is all good stuff. Let me just have a prayer for you. Heavenly Father, I just want to thank you for the way that you're answering prayers, for all the people around the room that are experiencing results. And Lord, I just pray that you will continue to be with them. Now, as we talk about augmenting diabetes reversal, please be with them and help them to assimilate things that they can do at home to increase the chances of reversal. In Jesus' name, amen.
So last week we struggled with keeping in sync here because the computer has one remote and this is the remote for the other. So this time he gave me one instead of me over here going click, click. He gave me one to keep up and I'm already clicking ahead trying to get the computer and it's not doing. So, and ye shall serve the Lord your God and he shall bless thy bread and thy water. And I will take sickness away from the midst of thee. So, who heals us?
Amen.
The Lord heals us, that's right. So, we just need to come in alignment with what he says, and he does heal us. So, as we've said before, this is for educational purposes only. We teach you what science is showing, and it's up to you and your physician to work together to implement and get the best results possible. So you need to forward that one.
Yes, I just did.
Our learning objectives for tonight.
Okay, what we want to do is by the end of this program, you should be able to define a therapeutic intervention. And you should be able to identify at least 2 ways to maintain your lifestyle while you're eating out. Yes, it is possible. And verbalize the optimal frequency for exercise. Describe the voice test as a measurement of exercise intensity. Describe 3 ways to improve sleep effectiveness. And identify if you may be at risk for a food addiction. So that's what we're going to talk to you about.
So the story tonight is about Rachel. And I brought her the sheet up with me because she wrote us a letter, and I want to read part of that letter to you. But, there are a lot of people that come and they learn and they do, but most people don't do everything that we say, but they still have a lot of success as they implement these things, not as a diet, but as a lifestyle. They incorporate these changes. And so that was the story of Rachel. When she started out, her A1C was 7.3. Her triglycerides were 680. Her cholesterol was 286. Her insulin resistance was 20.6. It should be 2 or less. Her weight was 197 pounds. She was on metformin, and she also had acid reflux really badly. So she struggled a lot with that. And so she and her husband came, and they sat right down front, and she was very quiet. She would check in every night, but she didn't say much to us. So we didn't know how she was doing. We didn't know what was going on with her. And at the end of the seminar, we did a follow-up about 6 months later, and she came, didn't say a whole lot again, but at the end of the program, she gave us a letter. And we chit-chatted with her, and we went home, opened up the letter, and started reading it. And here's what she said. I don't talk in a group, but I wanted you to know the story. I wouldn't have believed the benefit your body can get from following this program. I didn't follow the diet as closely as I should, but I had wonderful results anyway. I was having severe pains in my legs and feet. I didn't feel like walking anywhere. They stopped paining after the weight loss. I was having indigestion and taking prescription pills for indigestion. My stomach got so much better, I didn't need them anymore. My doctor had put me on diabetes medicine, metformin. I started monitoring my sugar readings. Most of the time, I didn't need my sugar pills. Also, my cholesterol, triglycerides, and blood pressure went down too. Having been overweight, I was told I was a borderline diabetic. I was beginning to get desperate and tried several ways to lose weight without success. I was having trouble walking. I heard about the seminar. My husband Jack and I decided to attend. I had doubts about losing weight or reversing diabetes, but you were so encouraging and supportive, I had to try. I gave up my colas, my sweets, and bread. I ate mostly vegetables. I lost several pounds fast. It was really worth the effort. After a few more pounds, the terrible pain in my legs stopped. And at this point, Steve and I, were nurses. We had been trained for years. By this point, I had been a nurse for 40 years taking care of diabetic patients. And we always taught our patients, once you get neuropathy pain, you will always have neuropathy pain. And so when we read that in her letter, the pain in my legs stopped, we turned to each other and we said,
This is not supposed to happen.
We were so shocked. It's like, well, but because the pain stopped, she started getting outside and walking, working in her garden, and taking care of her chickens again. She was so excited. She said, now I weigh 170 pounds. My A1C is down, and with an A1C of 7.3, was she a diabetic? Yes. Okay, it was down to 6.3. Her triglycerides were down to 220, cholesterol down to 252. Her insulin resistance was 5.7, and her weight was 169. And she was off of her medications. She said, I feel better than I have felt in years. I really do appreciate the time and interest you have given us. I'm so glad other people can benefit from learning how our health can be helped by your instructions on reversing diabetes. What a wonderful story. We're so thankful that she came and she learned, and that encouraged us as we encouraged other people who had the neuropathy, that it really could change.
So 4 or 5 years after, Karen gave Rachel a phone call.
I did. I wanted to check up on her. And she was fixing, was it? Broccoli. She was fixing broccoli. She was getting ready to eat when we talked. She still, at that point, she was having a little bit trouble, again, with some indigestion, but she was doing so much better, and she was so excited. And the pain in her legs was still gone, and she was out gardening and taking care of her chickens. With her chickens, that's part of the reason why her cholesterol was still up some. She says, I will never stop eating their eggs. But precious lady with a sweet story, and we're so glad we got to meet her.
Okay, I want to talk to you a little bit about interventions. The American College of Lifestyle Medicine, they've done evaluations of these different lifestyle interventions. And they've found some of them to be more effective than others. And so if an intervention, if they take a study group of people and they apply an intervention, and they get 50% or more of the people to reverse, then they call that a therapeutic intervention. If it's less than 50%, then they typically call that a subtherapeutic intervention. So they have evaluated all the things that we know in science that will help a person reduce their blood sugars. And they have found that there are only 2 therapeutic interventions. We'll get to those in just a moment. But one of the things that they also discovered is when you take a therapeutic intervention and a subtherapeutic intervention and you put them together, then that gives you your best chance of reversal. So dosage is extremely important. Now, that comes because, doctors for years have prescribed medicines, and dosage is very important. And so as we talk about lifestyle medicine and lifestyle interventions, then the concept of dosage is also an important concept. Now let's say, for instance, that you have a headache, and you go to the doctor because you've got a headache, and he prescribes for you a baby aspirin. Is a baby aspirin going to help your headache? And the answer would be, no, it won't, because it's subtherapeutic. And if he gives you, if you're very sensitive to medicines, maybe 325 milligrams would work, but more than likely it's going to be 650 to 1,000 milligrams that he's going to prescribe to get you to relieve that headache with that particular medication. So the same is true for lifestyle interventions. Now, if I say you need to increase your intake of green leafy vegetables and you add 1 salad a day, is that going to be enough to be therapeutic? Probably not. Exactly right. So what we need to do is we need to make sure that what we're doing is we're taking the lifestyle intervention in appropriate dosage. Okay? And so with that in mind, let's look at what these therapeutic interventions. There are only 2 of them that we found that if you do them, you will have greater than 50% chance of reversal. The first one is severe calorie restriction. Now the studies varied some between 600 calories a day, which is extremely
difficult.
Yes, severe. And 1,150 calories on the other hand. And they would do these diets, the 600 calories a day, for like 8 weeks, or the 1,150 for 14 weeks. And they found that that was effective at reversing diabetes. I want to caution people, I don't really care for this intervention because a person can get in trouble pretty quickly with that. You can develop some biochemical reactions in your body that can become life-threatening imbalances because you're starving yourself. And you're losing weight very rapidly. We've been shown in multiple studies that if you lose more than about 2 pounds a week, then you begin losing muscle mass instead of fat. And we don't want to see anybody lose muscle mass. That's one of the reasons why, as well, we encourage people to exercise, because the exercise stimulates the production of hormones that will help you retain your muscle mass. Anyway, the second therapeutic intervention is a whole food plant-based diet. And I really like this one because of multiple reasons. Now, right from our very first lecture, we said, that diabetes is caused in part because of a fiber deficiency. You're not getting enough fiber in the diet. We've refined too much of that out of the diet, and we explained some of the reasons why it was necessary to keep or to return the fiber to the diet. And the whole food plant-based diet gives you the fiber that you need. And if you'll remember as well, I also recommended that you do at least 30 varieties of different plants a week. So that's really important for increasing the microbiome in the large bowel that will help reverse your diabetes as well. So it gives you that. And with the whole food plant-based diet, then basically it's saying this. If the food was made in a plant, well, if it grew on a plant, eat it. If it grew as a plant, eat it. If it was made in a plant, don't. Okay? If it's made in a plant, it's probably been processed, it's been refined, fiber has been removed, so that'd be something that you would need to scratch out of the diet. Yes, ma'am, got a question?
When you talk about the 30 different
Varieties of plants a week.
if I eat a banana 3 mornings a week, that counts as what?
That counts as
One.
one. That's one variety, yes. Even though you had it 3 times, that's one variety.
There are different kinds of bananas.
A very good point. But every plant has its own fingerprint, if you please. Okay? So if you're eating a yellow banana 1 week, and you decide, well, I've seen these little tiny sugar bananas, I'd like to eat some of those. Then that is a different variety. And if you decide, if you can get a hold of them somewhere, you get some of those red bananas, red skin bananas. That's a different fingerprint, so that counts as well. And if you decide that what you're going to do now is you're going to do the plantains, that's a different kind of variety as well. So each one has a different fingerprint. It'll have a slightly different kind of fiber in it, and it helps give you more biodiversity. So green beans, you have a round green bean, you have a flat green bean. Yeah, okay, you got the idea. So that was a good question. There are two other kinds of things that typically you see on the internet that'll talk about diabetes reversal. One we have known about for 40 years. It's called bariatric surgery. That's things like the stomach bypass, lap band, whatever variety of bariatric surgery that very obese people typically have done to help them with weight loss. Usually, if they have that type of surgery, about 10 days later, their diabetes goes away. The doctor will take them off their diabetes medicines. Blood sugars return to normal. And so that's one of the things that stimulated the study that led us into this information that I have been presenting over these past few weeks about lifestyle and how it impacts disease. We have noticed that there's a big difference in the treatment, but bariatric surgery contains, it's accompanied by a whole host of side effects. You're talking basically something that's permanent, and I have seen people go from 500-600 pounds down to 160 pounds and then just die. To me, it is not a good thing. I would not recommend bariatric surgery for anybody unless they have totally exhausted every lifestyle intervention.
She says it takes the joy of
it does.
eating away.
Yes, because you become so restricted and you can only eat very small amounts. And then another thing that I see all the time is even with the restrictions, some people, they don't change the diet. And they may initially lose 100 pounds, but then they gain it right back because they're eating all the time, and they're So it's not a real good thing. I don't recommend it, but I wanted you to know about it because it is an option. And then there's one other option that is very common on the internet. You get on and look at diabetes reversal, and they'll start talking about low-carb, high-protein diets. Keto diets, absolutely. I absolutely cannot recommend that. Number one, it increases your risk of sudden cardiovascular death. Number two, it causes... You typically don't lose the insulin resistance, even though you will lose weight and your numbers may go down some. Everybody goes off of a ketogenic diet at some point in time, and when they do, you'll very rapidly gain the weight back, and the diabetes comes right back. So it's not a good option for, talking reversal. We want a lifestyle that is something that you can sustain for the rest of your life. And these are the options. So you need to choose, basically, which option do I want? Or do I want to stay on my medicines and take my gambles and whatever? And I know that you folks don't, because you're here. You want to know what will work to help me get over this disease. And then, once you've reversed your diabetes, a piece of birthday cake to help celebrate a grandkid's birthday.
Or your own.
Not a problem. Or your own. Yeah, that's right. Wedding cake. Yes, it could be wedding. Mm-hmm. Yeah, it could be all kinds of things. But remember, if you do what you did, you're going to get what you got. Okay? All right. Now let's talk about augmenting the diet. What can we do? We've learned about there are foods that we can eat that are going to be healing foods. So you have your food choice list that we passed out, what was that, last week, I think.
So the greatest impact on reversal is moving up into that green zone where you're eating more of the high nutrient foods. And foods that are high in water content also are very good, and that's where your green leafies come in. Also soups. Try to stay away from cream soups and do water-based, so you're not adding a lot of fat there. Also, water instead of the sodas or other drinks that have calories in them, you want to stay away from that. It's also helpful to eat foods that require more chewing because you'll feel satisfied. Plus, you don't take in as many calories. That's one reason why we encourage, if you're going to do a smoothie versus juicing, do the smoothie because there's more, you'll still get your fiber in it, but the juice, you're not getting the fiber with that. Eat a wide variety of foods as well. Don't get stuck in the rut having a southwestern salad like we did tonight. It's a wonderful salad, but there's a lot of other options as well. It's nice to have those every once in a while, but have a good wide variety. And then the presentation too. Make it colorful and garnish it. If you have a choice, if you're eating with somebody else, make sure that you garnish it, make it beautiful.
Eating out is always a challenge. Should you give up eating out? I'm seeing heads shaking one way and the other way. I guess it depends on you.
I think the women are saying no and the men are okay.
Okay. No, you don't necessarily have to eat out. Remember, though, this principle...
Give it up. You don't necessarily have to give it up.
Excuse me, yes. The principle that really holds here is what you do at home typically makes the greatest difference. Because most people don't eat out every day. But if you're one of those everydayers, you especially need this information. So look for heart-healthy or vegetarian-type options on the menu. Those typically are lower in fat, they're lower in the refined foods, and they will be better choices for you. What you're seeing up here on the screen is something that you could get like at a Chinese restaurant. It's called Hunan bean curd. And if you like spicy, you can get it very spicy. If you don't like it spicy, just ask for mild spice. There are varieties of that, but it's made out of the meat up there that you're seeing is actually a tofu that's been prepared, and it makes a delightful meal out. So there are options that you can do. Now, one of the things you can do as you look at the menu is gravitate toward something like a steamed vegetable rather than a fried vegetable, for instance. I just think of the hospital I recently worked at. Go through the cafeteria line, there was always fried chicken fingers, and then oftentimes you would have fried jalapeno poppers, you would have fried corn bites, and everything was fried.
French fries and potato wedges.
Yes, I mean every day those were basics on the menu. And when they did have vegetables, oh my. It's no wonder people don't like vegetables. They're carrots. They tasted like soggy balsa wood. The only way I could get it down is just turn it white with salt. And I know that wasn't healthy either. But learn how to prepare the foods so they're tasty. I would love a church social. Can you imagine this? A church social that the theme of the social is a carrot cook-off. Everybody brings a potluck dish to the meal, but it has to have carrots in it. Okay?
All right.
Yeah, wouldn't that be exciting? I think so. I mean, it would just be a culinary adventure. Someone, I can cook carrots waterlessly in a stainless steel pot, and they are so tender and succulent they just melt in your mouth.
So that's a form of eating out. If you're eating at potluck, you eat carrots. But you want to, if you have a choice, do baked potatoes instead of fries. Another is to do the dressing on the side. I like to do this, and then I just put the tines in my fork, I dip it into the dressing, and take the bite of salad. You're still getting the flavor, but you're just getting a tiny amount of the calories compared to if you just pour the dressing all over the top. Another is to replace meat with mushrooms or vegetables. Mushrooms are a wonderful substitute for meat. Beans instead of meat is another really good one. Taco Bell or a lot of your other Mexican choices. You can get beans substituted in any of their recipes. And then order sides. A lot of the times, this is what we need to do when we're traveling. There may not be a really healthy choice on the regular menu, but on the sides, you often can get a baked potato, and I go for broccoli. He might get something else, but anyway, carrots.
There you go.
And a side salad. Those are things you can get. They'll always hold the cheese if you want. Or
talk to the chef. Guys, we have had some of the most awesome experiences. I think about the 13th floor, Arlington, Virginia. We were staying in a hotel, and the restaurant's way up there on top. You're down and overlooking the Pentagon and other things, But went into this swanky restaurant. I looked at the menu. There was not a vegetable option on the menu. The waiter comes out, and I said, "Don't you have any type of vegetable plate or whatever?" She said, "Just a minute, I'll go get the chef." Chef comes out, "Sir, can I help you?" I said, "Yes, I was looking at your menu and I don't see any vegetable options. Do you not have a vegetable plate?" "Oh, yes, we can provide you with a vegetable plate. That's no problem." And how about? And he just listed off several things, and pretty soon they come out with this gorgeous vegetable plate. And
he got some vegetables and I got other vegetables, and then we eat half of it and we trade plates, and so that way we get more variety. So
there was another restaurant that was particularly great. We were in Tampa, Florida, and we went into a Greek restaurant. Now, no, it wasn't.
No, it
Papa's.
wasn't.
We were actually looking for Papa's restaurant. We were looking for that. No, I don't remember the name of the restaurant. We were looking for a Papa's restaurant, but because we've had some of their Greek potato salad, it's just like to die for, And you had it once, you've got to go back again.
But we couldn't find it where we were.
We couldn't find that where,
so.
It was in North Tampa and we were in South Tampa. So anyway, we found this Greek restaurant and we went in. There were not many customers there, and we thought, well, what are we getting ourselves into? Usually I want to go into a restaurant that has a lot of people out in the parking lot, but this was sort of in a downtown district. And anyway, we went in and we got the waitress brought us the menu, and I was looking over the menu, and it looked pretty sparse for the kind of food I wanted to eat. I wanted good diabetes reversal type foods. So I said, well, don't you have a vegetable plate? Well, I don't know. Well, can I speak to the chef? The chef came out, big jolly fella. He was so much fun. What seems to be the problem here? I said, well, I was just looking at your menu, and I don't see any whole food plant-based options on your menu. Do you have anything we can do? Oh, of course, he says, choose anything you want off the menu. We can substitute. Go for the shrimp scampi. I can put mushrooms in instead of the shrimp. We can do substitutions, and he just lists off a whole bunch of different options, and suddenly I have all kinds of options. Great meals. Knoxville, Tennessee.
Mr. Wickham, we're on slide what?
Okay,
About
well, I have to tell them this
6?
story since I already
And
brought it
there's
up.
46 to go.
We had a little guest with us, and she wanted to eat vegan. Now, it's hard to eat vegan when you're eating out all the time. And so we went into a restaurant in Knoxville, and we said, do you not have any vegan options? Oh, yes, we do. Just a minute, I'll go bring you a menu. She came out with a menu, 13 pages of vegan options.
Stapled together.
Now, this was actually at an Olive Garden on Kingston Pike. So if you're ever there and you want to eat vegan, go to Olive Garden on Kingston Pike. They know what they're doing. I've gone to other Olive Gardens because I figured, well, if one Olive Garden has it, the next one does, and they have no idea what you're talking about. So somebody there was really sensitive to this kind of issue, and yes, they had all kinds of options. You know, the proprietors of the restaurant know that if you have a dietary preference and they cater to you,
and you'll tell your
absolutely.
friends you'll
you're
be
going to
back.
come back and you're going to bring all your friends with you. You know, we're going to have an outing of all the people that went through the diabetes course, and we're going to have a great time. Anyway.
I already moved it forward. All right,
Oh, that
so
means we're supposed to get on with this,
we're
right?
going to get in turbo
This is
now because
good
we have a
stuff.
lot to cover. The second most important intervention that you can do is to get up and get moving. Increasingly, our lifestyle has become more sedentary, and we do need to be moving. We have a lot more screen time than what we ever had as little kids. And so very few people will reverse diabetes just with exercise alone. But if you put it together with the dietary changes, as Dr. Wes Youngberg says, he says you cannot out-exercise a bad diet. But exercise is very important. So we're going to talk about that. How much do we need?
It depends on who you talk to. Basically, the sky's the limit. The more exercise you do, typically, the better off you are. The CDC says you should have at least 150 minutes of moderate exercise a week, minimum. But optimal is 300 minutes of moderate exercise a week, or 150 minutes of vigorous exercise a week. So it's hard to get too much exercise. We were built for exercise. So I was talking to Dr.
Harold Meyer.
Harold Meyer, yes. And he's a physiologist. He lives, breathes, thinks, whatever, physiology. And he's done many studies on it. He's published multiple times. But I was talking with him personally one day. He said, if you exercise one time a week, it will do you little benefit. If you do at least 5 episodes of exercise a week, then you will start to feel good. 6 episodes a week is actually optimal. And if you do 7 days of benefit, 7 days of exercise, you lose all benefit.
It's like you went
He says
back.
your body is built to exercise 6 days a week, but then you need a day of rest. And so it's built into our physiology. And so, the lifestyle that you choose definitely has some approaches here. Now, people that live to be greater than 100 years of age typically don't have exercise programs.
No, they build it into their lifestyle.
That's right. It's built into their lifestyle. They have very active lifestyles, and they do the exercise, which helps them maintain muscle mass and functionality. When you get to about 35 years of age, you begin losing muscle mass at the rate of about a pound a year. And then by the time you reach 70 years of age, you're losing 2 pounds of muscle mass a year. By the time you're 75 years of age, the average person cannot bend over and lift up more than a gallon of milk off the floor. That's because they're losing their muscle mass. But if you will exercise, the exercise keeps those muscles growing, keeps them firm, and at any age, a person can begin exercising again, and your body will secrete hormones that will firm up the muscles and cause them to grow back. And so you'll realize benefits. So if you're 99 years of age and you've been living a sedentary lifestyle and you begin an exercise program, you will extend your lifespan. It just goes that way.
So remember that failing to plan is planning to fail, and that's not what we want. So how do you know if you're getting enough exercise? There's a voice test that you can do, and this is a good thing to remember. This is one of the things on our learning objectives. How can you measure that you're getting enough?
So if you're going well with somebody on a stroll and you can talk comfortably, that would be a light level of exercise. But if you are exercising at a moderate rate where you can talk but you can't sing, okay, then that's moderate exercise. That's what our goal is for that 20 minutes right after you eat, is the moderate exercise level. And then vigorous exercise, you're really working hard and you can gasp out a few words, but that's about it. You can't talk comfortably. That's vigorous exercise. And these are really fairly accurate measures of the intensity of exercise. It requires no special equipment, and it's good for you. So now let's go back and talk just a little bit about what we covered on our first lecture. Thank you guys for coming. We know you have to leave early, but it was good to see you here, and hope you do well this week. Okay? Lifestyle interventions that
Improve
insulin resistance are weight loss and diet, and then the exercise portion. You have to, they found that elderly people, when we start reversing with lifestyle, they will reverse about 80% of the way in the plateau. But if you add that exercise component, you'll be able to take it all the way down to reversal. So anyway, now, the more intense exercise is best. Now, you know, when we in our cells, you learn we have furnaces. There's a scientific name for that. We call them mitochondria. And when you exercise, if you exercise vigorous exercise, it will stimulate your body to put more furnaces into action. You know, it's like you're firing up the furnaces at the power plant. So you'll put more of them into action. And when you exercise vigorously, you will use what's in the cell. So, you know, we start doing our burst training. The burst training, what happens, you burn up what's in the furnace, the fuel that's in the furnace. You know, you exercise to the point you start slowing down a little bit. Usually that takes 30 seconds of going just as hard as you can go. And then we'll start slowing down 25, 30 seconds into it. Okay, that's the optimal place that you want to be. Because what happens in the next minute, your body reaches into the stores of extra energy that are in the cell. Lysosomes, I think is what they call them. It reaches into that extra store, that cabinet, that reserve, and it pulls out some of that stored energy, throws it in the furnace, and boom, you can go again for another 30, 35 seconds. Okay? And if you do that repeatedly, we say 10 times a session, what it does is it increases your metabolic rate for up to 72 hours. So you're burning more energy even while you're sleeping. This will augment the possibility of weight loss, because your basal metabolism rate goes up and you're burning at a higher level now. But inside the cell, you have something that we call a metabolic memory. And the metabolic memory, it sort of keeps track of how much those reserves were. But if you don't eat for 2 hours following that episode of exercise, your body will not build back completely. So your level of reserves go down, which means your insulin resistance goes down, and you do that repeatedly, and over a period of time, it pulls your insulin resistance right on down. So that's one of the reasons why the exercise is so important.
And you want those repeated episodes of the vigorous exercise, and we're going to show you a picture in just a couple minutes about that. So
Okay.
you've talked about all that.
Okay, good. Oh, guys, we had a thing at work. It was a walking competition to stimulate people to be more active, and so I went to them one day and I said, "Well, how
How many points do I
how many
get?
points do I get for skiing?" Because they had equivalent walking points, and they said, "Oh, you don't get anything for that. That's just skiing downhill." That person had never skied. Let me tell you what. If you want quads to burn, that's intense exercise. You get to the to the bottom of the hill, and you've really been burning some stuff. But anyway.
I don't know if you can tell, but that is Steve out with a couple of our grandsons. He absolutely loves to ski. So this is one of the things that he does for exercise when he gets a chance. But the benefits of that is it helps to control the blood sugar. You do have weight loss, lower the blood pressure, reduce the nerve damage, reduce the heart attack risk, and it raises the good cholesterol and lowers the bad. And that's what we want.
Okay, so the
We've
exercise
talked about-
also helps prevent muscle mass, and I'm not going to go too much into that. We've talked some about burst training. Find some kind of exercise that you enjoy doing. I enjoy, you need to do your thing.
Whoops.
I enjoy doing several kinds of activity, and this is one of them. Give me a kayak any day, and I'm just really happy. Okay? So,
But you see how hard he's working in the one, and then he's resting. There he's resting.
oh well. Yeah, paddle hard and then rest. Do the white water occasionally. First, talk with your doctor before you engage in any exercise program. Just for your own personal safety, make sure that you don't have issues that are going to be a problem for you. But compared to treadmill tests and hour-long aerobics classes, burst training helps you burn fat more efficiently and more quickly. We've gone over this several times in the course. I just wanted to cover this so you would understand. 20 to 30 seconds of vigorous exercise. 30 happens to be optimal. 20 is sort of a minimal. So start with 20 seconds and then you increase to where you're doing 30 seconds. Repeat it. It's a repeat of exercise and rest. So you'll rest 1 to 2 minutes or until you catch your breath after that. And I just explained to you what happens in the cell. But this is what you're an illustration of what you need to do. Intense exercise, rest. Intense exercise and rest. Intense exercise and rest. You do that 10 times. And that's one set. Yes, question?
I have a small trampoline at the house.
Yes.
And I found that jumping on it for 2 minutes and then walk through the house and then get back on it for 2 minutes works real good.
Okay. You can go 2 minutes, but...
You need to repeat that.
Okay,
Online.
yeah, he has a trampoline at home for those of you online, and what he does is he jumps on the trampoline for 2 minutes and then walks through the house until he catches his breath and goes back and does it again, and for him that works really well. The optimal time for the burst training, according to the studies, is 30 seconds. Go just as hard as you can go for 30 seconds, and then rest 1 to 2 minutes, go back and do it again, do it again, do it again, do it again, and again and again. So it'll take you about 15 minutes to do one set of 10 repetitions. Mark your calendar for Monday, Wednesday, Friday. Why every other day? That's because you have increased fat burning that occurs for up to 72 hours after each session. If you can add it in every day, up to 6 days a week, that's optimal. Be sure you get your day of rest. And then the biggest benefit of all this is simply that it increases your insulin sensitivity. That means you're driving diabetes in reverse. Okay? So, and there's lots of other benefits to exercise, increasing your lean muscle mass, improving cardiovascular health. It actually causes you to secrete something called a human growth hormone, and that's what makes your muscles firm following exercise, especially repeated exercise. It gives you increased energy because it puts more of those furnaces into action in the cells, actually helps you develop more of those, and it reduces inflammation. So all good stuff. So where to find out more? You say, well, I just don't know what to do. Well, if you're in a quandary, don't know what to do, go to YouTube. Get on YouTube and then search for low impact burst training. For people that are getting along in years and can't take a lot of jostling or real vigorous stuff, some of these will work really well. Others of them, even though you say low impact burst training, they will be tough. Okay, we need to talk a little bit about sleep deprivation. It's a real problem with people with diabetes. And it affects 1 out of every 2 people with diabetes. And causes elevated blood sugars, and it also causes increased insulin resistance. So you need to pay attention to your sleep patterns. 1 in 4 people with diabetes especially get less than 6 hours of sleep a night. That's problematic because if you're getting less than that 6 hours of sleep, your chance of reversal goes way down. 1 in 5 people will experience restless leg syndrome. And that's where your leg will just jerk during the night and keep you awake. Anyway, 1 in 4 have obstructive sleep apnea, which also is known to cause increased insulin resistance and make diabetes worse. So treatment does definitely increase your chances of reversal. So what should you do about that? That's the next question. And one of the best things is to adhere to a good plan that controls your blood sugars. So get your fiber levels up to 50 grams or more a day. Blood sugars will gradually come down under that kind of plan, even though you're not counting calories, even though you're not measuring portion sizes, it will still come down. And it helps keep your blood sugar controlled, and that will help keep you from spilling blood in your urine. If you're spilling blood in your urine, then you'll be waking up in the middle of the night to have to go to the bathroom. So get into a regular routine. The experts tell us that we should try to go to sleep within 5 minutes of the same time every night, because your body will get into a circadian rhythm. And as it gets used to that rhythm, 9 o'clock's my bedtime. Oftentimes within 5 minutes of 9 o'clock, I say I'm crashing.
Lights are out.
Whatever you're doing, you keep on doing it. You can do whatever. I'm going to bed. And so that will happen if you get on a regular schedule.
You also want to avoid stimulants in the evening like caffeine or nicotine just before going to bed. And also keep the bedroom cool, dark, and quiet. They say the best temperature is 65 degrees. You get under the quilt, under a blanket, so that you can snuggle up and you will sleep better. If it's too warm, it's challenging.
Now I want to change the subject a little bit. We're going to hit on some things, with one of those is food addictions. And I'm not going to go real deep into this, but I do want to give you an exposure to the idea of why this works. Well, what is an addiction? An addiction is, you'll hit that one. An addiction is a complex condition, a brain disease that is manifested by compulsive substance use despite harmful consequences. People with addictions, severe substance use disorder, have an intense focus on using a certain substance, such as alcohol or drugs, to the point that it takes over their life, and they keep using the alcohol or drug even when they know that it will cause problems.
A problem.
So addicted persons have distorted thinking, behavior, and body functions. And there are changes in the brain's wiring are what cause people to have an intense craving for a drug and make it hard to stop using that drug. So an addiction is an intense want or craving. Now, there is something that we call the rewards pathway. And with the rewards pathway, it starts in the ventral tegmental area. It becomes excited, the VTA. And the VTA sends a signal through the brain to the nucleus accumbens. And there it causes a release of a substance called dopamine. And that gives you a pleasurable response. And so you become conditioned to that particular thing, and you will come back and you'll repeat that behavior over and over again. Well, this actually is a wonderful survival technique. When you sit down at the table and you eat a meal, it stimulates your reward pathway.
A really good meal.
But it stimulates your rewards pathway, and so you get the release of dopamine. And that dopamine goes around to the front of the brain, the prefrontal cortex, and you can even get it with a glass of water. Other behaviors can cause the same kind of thing. Sexual type behaviors causes the release of dopamine, and so people come back and they do those things over and over again because of the excitement that's caused. Now, when you take somebody, for instance, that uses a drug typically will give you a stronger dopamine release than something like a food. But you can develop a sensitivity to a food, a learned behavioral reaction to eating foods just like drugs, and it can become a problem. So when you have a hyperactive dopamine response, what the body does is eventually it will recognize that this response is greater than what it should be, and so it begins dialing back the amount of dopamine that's released. And when that happens, you start taking more and more of the drug to give you a greater response. See?
So the same thing happens with food. We have to have more and more of it to get that same dopamine release.
So these behaviors become conditioned, and so you begin to anticipate various triggers that are going to give you that feeling. So it becomes it's actually a learned behavior, but some people are much more susceptible to it than other people. It depends on the amount of dopamine that is released there. So eventually you develop this thing called tolerance. And with tolerance, your brain is releasing less and less of the dopamine, and eventually depression results. And then food addictions are much like cocaine or meth addictions. They involve this rewards pathway and cause the release of dopamine. And if you're overeating, you can suppress the expressions of various hormones. And these would be hormones that govern hunger and eating patterns, and it allows the addiction then to surface, and it begins to control the individual if they are susceptible. And one of the things that they have learned is the speed with which you get that sometimes makes a big difference. So oftentimes these people will begin hiding and eating very rapidly. They will hide and they will eat very rapidly whatever these trigger foods are that give them that dopamine release. And they will begin lying about it. They will begin withdrawing from other people in society. And what they're after is they're after the intensity of the release. So symptoms, you can have impaired control, craving to use the substance. All you can think about, I need some more ice cream. I want some more chocolate. I want, usually it's something salty, it's something sweet, it's something made with fat or refined flour, or a combination of those things. And it's different for almost every individual. So for one person, it might be that the thing is ice cream. Another, it may be chocolate. Another, it may be potato chips. Another, whatever. And so it has this, you know, these individuals will know that this is causing adverse effects. Maybe they're gaining an you know, they're putting on too much weight. They know that they're withdrawing from society. They know that
They've lost interest in doing things. They used to always come to the family gatherings or always come to potluck. Well, they don't come anymore because these other behaviors are going on, and they need to be away where they're not with people so that they can do those things.
So, you have all these various things that happen. So I wanted to do a little thing here. You have a paper. Everyone should have a paper. Anyone not have a paper with numbers down it? You should have 14 numbers or so. And I'm going to use...
Debbie, can you pass out? Okay, number 1 to 14. Does everyone have a pen or pencil?
And let's see.
Okay, and don't look at I've got the sheets here, Steve.
Yeah, but...
They're all the questions are right here.
Or is that...
What?
I was looking for the lady that is expert on food.
Oh, I can't tell you
Okay.
that.
Anyway, I'm sorry I don't have that for you, but that'll be on in the references. If you'll look back. No, you don't have that either.
I've got it right here.
Okay.
Okay, does
So-
everybody have a paper? And you've got it numbered 1 to 14.
I think the doctor's name is Dr. Vera Tarman, if I'm not mistaken.
All right,
But
let me go through this,
she-
and you can look at the,
Okay.
over there.
There you go.
Okay, just put a Y or an N.
For yes or no.
Yes or no? Number 1, have you ever wanted to stop eating and found you just couldn't? Number 2, do you think about food or your weight constantly? Yes or no? Do you find yourself, number 3, do you find yourself attempting one diet or food plan after another with no lasting success? Number 4, do you binge and then get rid of the binge through vomiting, exercise, laxatives, or other forms of purging? Number 5, do you eat differently in private than you do in front of other people? Number 6, do you eat to escape your feelings? Number 7, do you eat when you're not hungry? Number 8, have you ever discarded food only to retrieve it and eat it later? Number 9, do you fast or severely restrict your food intake? Number 10, have you ever stolen another person's food? Number 11, have you ever hidden food to make sure you have enough? I won't repeat that. Number 12, do you obsessively calculate the calories you burn against the calories you've eaten? 13, do you feel guilty or ashamed about what you've eaten? And number 14, well, you don't have to admit it. Number 14, do you feel hopeless about your relationship with food? All right, total up your yeses. Number 1 was, have you ever wanted to stop eating and found you just couldn't? Count up your yeses, count up your nos. Okay, you got your total?
Okay, if you had 3 or more yeses, you might have a problem with food addictions.
You don't
So-
have to tell what you got, but I can tell you the first time I did it, I think I had like 11 or 12 yeses. I've learned a lot, folks.
So how do
Okay.
you control food addictions? Number 1, you need to avoid the trigger foods. If you know something is going to put you on an eating binge, then just determine in your mind you're never going to eat that again. You can get professional counseling. There are people that actually can help you. They have specialized in this area, and they can offer you help there. Dr. Joel Furman says if you would avoid your trigger foods, but go with a whole food plant-based diet, he said for many people, that's all they need to do. And the whole food plant-based diet will help them control those food cravings. Up to a 3-day water fast will help you reset your hormones. But when you come off the water fast, do not binge. Break your water fast slowly and remember, pay attention to what your hormones are telling you. If it tells you to, that you're hungry, you can eat. But if it tells you you're getting full, don't eat the rest of the stuff that's on your plate. Stop immediately. Allow those hormones to talk to you, to tell you when you're full and when you're not. And that will help as well. And be sure to ask God for help, because the Lord can help us with all of our addictions, whatever they are. Now, we're talking about augmenting diabetes reversal. And one of the things that actually can speed you along with diabetes reversal is fasting. There are a lot of benefits of fasting. You have a sustained increase following the fast in the release of dopamine. So you're going to feel better when the fast is over. And it makes it much easier to overcome an addiction if you're struggling with food addiction. It also restores your appreciation for whole plant-based foods. A lot of time people will say, no, I don't want that stuff. That's nasty. Speaking of fruits, vegetables, that kind of thing. I think one man, I had in the hospital, and this guy, he had nothing good to say about the food. So he ordered out, and what did he order? This particular meal, it was chicken nuggets. Now this is real food, fried chicken nuggets. No use for what's on his plate. It was a good balanced meal that Dietary had sent up. It was a heart-healthy meal, but no, he wasn't willing to eat that. So anyway, but it does help that. I get these patients in, they come into the hospital for diagnostic procedures, and the doctor makes them NPO, and it just never ceases to amaze me. I walk into the room after the procedure's over, and these people are hungry. They're hungry to the core because it's been 24 hours since they've eaten, and they are totally ready to eat. Oh, that sandwich was so good. Well, I said, you starve anybody long enough and they'll eat anything. But it does help. It does help. So, but it also heals the neural pathways in the brain. And it reduces oxidative stress and inflammation.
Which we're going to talk about next week. That's our topic. We'll
and relieves depression. It restores your immune system. It just resets the hormone. It improves cognitive function and improves productivity. It's one of the fastest things you can do. Intermittent fasting. It's one of the fastest things you can do to defat the liver. Eat breakfast. Make sure you get your fiber quota. So if you're eating 2 meals a day, how many grams of fiber are you going to have with breakfast? 25. That's right. 25 grams of fiber with breakfast. Then about 6 hours later, 5.5 to 6 hours later, you eat your next meal. How many grams of fiber there? 25 as well. And then you don't eat again until the next morning. You sleep while you're most hungry. Right at first, it'll take a little willpower and a little getting used to. But if you do that on a repeated basis, within a couple of weeks, you'll probably have your normal blood sugars showing up in the morning. And then if you will stick with that for 6 times longer, it takes about 6 times longer to defat the pancreas than it does the liver. So stay with your program. And what will happen at first, right at first, your AM blood sugars, your fasting blood sugars will gradually come down. When they get to normal, you just mentally figure it out. That's 1/6 of what I need to do. Continue the same program for 6 times longer. And then by that time, your pancreas should have returned pretty much to normal function. Okay? So the name of the game is sticking with it. So our topic next week is the dangers of oxidative stress. The Lord says, confess your faults one to another and pray for one another. It doesn't say confess your sins, but, talk about difficulties that you might have. It's okay to admit that we have some difficulties, but pray for one another that you may be healed. The effectual, fervent prayer of a righteous man availeth much. Okay, so click over a couple slides there, and let's go to...
To what? Oh, on this?
Yeah, coaching objectives. So I want you to, when we break into our groups, I want you to share with your group which therapeutic intervention you have chosen and why. Remember, there's 2 of them, right? 2 therapeutic interventions. That's all. Just share with your group which one you've chosen and why. And then identify additional interventions you want to do that you're going to include in your reversal plan. And describe how well you are adhering to your plan to this point in time. And share your thoughts about food addictions as well. Talk to the rest of the people, see what they have to say at your table. Okay, Debbie, you're on.
I don't know, it's best for you to keep having.
Oh, that's getting pretty good. We must be getting down here to the end.